Welcome to the Humble Hoof podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. From the moment I heard about who Stuart Muir was at the NEAEP symposium, I knew I would like him. Anyone who coordinates Paige Poss and Dr. Bowker to speak at the same conference is probably an above-average human being. Armed with this information, I introduced myself to him at the symposium and asked if he would be on the podcast. I wasn't quite sure what the focus of the episode would be yet, but when I heard that he was doing a session on vets and farriers working together, I knew I wanted that to be the focus of the next episode. Stuart and I talked about a lot of aspects of working with veterinarians in our hoof care business. We touched on how to build relationships, ways we can present a united front to the client, and how valuable it can be to work with a veterinarian, especially in terms of their knowledge, experience, and the use of imaging equipment to better inform our decisions. So why don't we start and say your name and how you're involved in hoof care?
My name's Stuart Muir, and I'm one of the resident farriers at Equine Hospital in Lexington, Kentucky. I become interested in hoof care actually at quite a young age. I had a pony, like most children do, and my farrier would come and work on this pony, and I was always intrigued by what he was doing. And I got chatting to that farrier, and he was a nice older guy, and he turned around and said to me at one point, he's like, you should really give this a try if you're interested in horses. So just like that, I picked up the rasp and I trimmed a foot that day as soon as he offered. And I remember it quite well, and like in my mind's eye, I can still see that foot. And I don't know if I would agree with that same job that I did today then. But, that's kind of how I got into it. And then from there, every time he come to shoe my father's and my horses, he would always get me involved with the process. And eventually, I was still at school at that point. We built up a rapport and relationship with him, and during my school holidays I would go and work for him for free, just trying to gain more and more experience. And then eventually, when I was ready to finish schooling, he took me on as an apprentice for 4 years, and that was great. It really opened me up to a lot of cases within New Zealand, and we shot a large amount of horses, and there was certainly a lot to be learned during that time. I also become involved with the New Zealand Farriers Association, and I started my certification process with them while I was still under apprenticeship with that older gentleman. And also during that time, I was lucky enough to spend more time with another farrier called Norm Brown, and he had a little blacksmith shop next to a bar, basically. And he had an old coal forge where I'd sit there and make shoes with him on a Saturday, like just for 4 or 5 hours. But he was a wonderful old blacksmith. And from there, I got my certification and through the New Zealand Farrier Association, and I started my own business when the gentleman that I was working for retired. I took on a lot of his clientele, so I was very lucky there. I kind of just worked away for a few years, kind of establishing that clientele and trying to better myself as a farrier and learn as much as I could. I started to attend seminars and workshops, and eventually, I was just very, very thirsty for more and more information, because it seemed the more I thought I knew, the less the practical side of it didn't all kind of stack up, and I figured that I was a variable in that. So I certainly looked to get as much education as I could. From there, after a certain amount of seminars, I was flying to America, and I was flying all over the show to try and, get that education that I was looking for, always looking for that next piece of information to, put all the pieces of the puzzle together. New Zealand has a New Zealand Equine Research Foundation, which they have scholarships available for the betterment of veterinarian and farriers. And eventually I was lucky enough to get one of those scholarships. It actually flew me to, I used the money from the scholarship to get to America to attend the International Hoof Care Summit with one of the veterinarians from New Zealand, which was great. It was a huge thing for me, and, that really helped my education and pushed me along. From there, I went to Radiographic Equine Hospital for the first time afterwards, because, of course, from Cincinnati to Lexington, Kentucky, it's only an hour or so away. So I externed there for a week at the hospital, and that's what really amazed me, because I could get the educational side from the seminars, but I really needed to see the hands-on side. And of course they were doing a lot of glue work at the time. This is probably going back 10 years ago. And I came home and I started to put all the pieces together, and But unfortunately, my thirst for knowledge still wasn't kind of satisfied. So I actually flew myself back to Rood and Riddle. It was about 2 years after that, and I spent another week or 10 days at the hospital. And I turned up there, and they kind of said to me, they're like, "Oh, are you here for the farrier's job?" And I was like, "Well, no." But I said, "I might be. Tell me more about it." So I called my wife, and I was like, "Hey, on a whim, how do you feel about moving to America?" And she's like, "Yeah, why not? Let's do it." So I rushed down to a clothing store and bought a nice shirt and a clean pair of jeans and started the interview process, which is like a work along, ride along. I came back to New Zealand afterwards, and we just awaited the email, which I eventually got, and Dr. Morrison asked if I wanted the job. And that's kind of brings you up to where I am at the moment in my career, I guess.
Yeah, and it seems like you do a bit of traveling too. Do you travel a lot to teach or just to work on horses, or both?
A little bit of both, really. With the hospital, the clientele we attract can be from all over the country. And so within the hospital, it's, there's essentially 4 podiatrists. There's Dr. Morrison, Dr. Brass, Dr. Fleming, and Dr. Lesser. And they'll all have farriers kind of riding along with them. And so the cases will come into the clinic generally. We will get that kind of the pathology or whatever is going on kind of somewhat under control, and then the podiatrist will kind of hand it on to the farriers to kind of maintain. And so with that can come a little bit of travel once these horses go back to whichever state they come from. Sometimes we'll travel out to work on them, or, it could just be that the barn has a need. And like I've been kind of working in Chicago and Michigan in the past few years, and Columbus. And of course, then there's the winter circuit in Florida, which I'll make, monthly trips down to make sure my clients are looked after down there. So along with that, there is a teaching kind of side of it as well. I enjoy lecturing and trying to help other farriers, try and figure this farrieing deal out a little bit, because, it's such a huge learning curve, and trying to access that information. If I can speed up someone else's process, I'm certainly more than happy to do so.
Yeah, definitely. And, I was able to go to the NEAEP symposium about 2 weeks ago now, and I found out from Paige Poss that you had been in charge of helping with figuring out who was going to be speaking for the podiatry side of things. And I thought the speakers were all fantastic, and that was actually what drew me to go to the symposium. So can you talk a little bit about how you chose those speakers? Yeah.
It was a really interesting process, because in my mind, I wanted to put together a program that sort of complemented each other, and it was cohesive. So my focus this year was shoeing to internal anatomy, because I think quite often as hoof care providers, we can get very fixated about what we're seeing externally in the hoof capsule, when ultimately, everything we're seeing on the outside comes from the inside. Like I had Dr. Bolker and Dr. Van Epps, and of course Paige. I mean, there's no one better to display internal anatomy and hoof capsule distortions than Paige. So before I knew it, all these kind of speakers came together. And, like I say, I think if we can start to think about the hoof capsule from the inside and what kind of, anatomy we're trying to stimulate with our work. And it doesn't matter what work we're doing, whether we're barefoot trimming or whether we're shoeing or whether we're trying to address pathology. Ultimately, it's those internal structures that we're trying to influence. So the great thing about the NEAEP is we always try to have, new information for our attendees. We try to have a certain focus within the meeting. But having veterinarians there so we can get on the same page about stuff, it's so good. I think veterinarians are also seeing how much influence good footwork has on the horse. And so they're interested from their ends as well. You think back 10 years ago and a horse equine podiatrist was almost unheard of. And now, certainly in the bluegrass, that we're seeing more and more pop up where they've not only done a veterinary degree, but they're certified journeyman farriers. It's a very cool movement.
So my name is Dave Dawson, and I've been a farrier my first part of my career, this year being 25 years. About 3 years ago, I took on the position as Executive Director, CEO of the Northeast Association of Equine Practitioners. And for the last 3 years, we've been looking at bettering this association and trying to work on the veterinary-farrier relationship and developing new ways that we can try to help them, let's say, get along better, work together better, understand each other's profession better. And that's a large part of what we've been doing. I suppose one of the biggest things that I feel very strongly about, and one of the things that we openly communicate about at the NAAP board level, is that if we really want veterinarians and farriers to be able to work together cohesively, we need to do away with the whole ideology of a shoeing prescription. Even with the AAEP Vet Farrier Short Course program that I'm very fortunate enough to travel around a little bit and give to new veterinary students, we very much focus on that, and we very much teach that a good veterinarian that really wants to get involved with equine podiatry should align themselves or get to know the farriers that are in their area and get to know who are the ones that they can work with. It's very important to establish this working relationship so that you can call each other in, and it works both ways. You can call each other in to work on a case, and you sometimes already half know what the other person is thinking if you've worked with them enough. And this type of relationship exists not just in the veterinary farrier world, but it's everywhere in the working world. And we have to find people that we can work with in a very good way, because it's the horse that benefits ultimately, and also the owner through that working relationship. So example is we have a problem that's identified with the horse that the veterinary thinks that farriery can help, or if there's an area of the farriery that the veterinarian isn't quite sure of or doesn't think it's something that is working well for that particular animal, then just being able to identify the problem or talk about the problem with two people working together, as opposed to writing a prescription and having somebody do it or fulfill it. It's not the way, we're not prescribing medication. So when we're working with two individuals, we need to go at it from a different perspective. One of the things that we are trying to work on at NAAP is the language that exists between farriers and veterinarians. And that is, farriers don't necessarily understand veterinary medicine because they're not educated in it. And veterinarians don't necessarily understand farriery because they're not educated in it. However, what happens is we get lost in this problem that all of our horse owners and trainers, and let's call it the equine society, gets lost in, and that is knowledge through ignorance and knowledge through past practice, but not necessarily knowledge through continuing education or understanding exactly what it is that we're doing. We get a lot of people today that look to Dr. Google to figure things out and to work on things and think they have a solution and be their own self-righteous experts. And that creates a big problem between two working professions like the veterinarian and the farrier. And whenever we get a veterinarian that comes into a barn to work with the farrier, or just working with the client, the farrier isn't there, and the veterinarian considers that they have knowledge and experience to be able to comment on the applied farriery to the equine animal, that's where the slippery slope starts, and that's where we start to get a problem. And it's the same thing with farriers, and farriers being in barns every 5 weeks, 6 weeks, whatever the time frame would be, they more than likely see the horse owner more often than the veterinarian does. And if the farrier starts to comment on veterinary medicine or veterinary practice, or by ways that people are practicing, that also is the point that starts an extremely slippery slope. And if we could spend more time on educating our professions on appropriateness, on how to be and how to be appropriate, how to be professional, that I believe we will start to change the way this is visualized by both professions. And that's something that we have a committee that is going to be working on. And hopefully that's something that we'll be able to come out in industry with to, I guess, not really say to people, smarten up, but in essence, that's what it's saying. Smarten up and start treating people better and start treating each other right. And then we can start to do better, if that makes sense.
So at the NEAP symposium, you had a session too, and you were talking about working with vets on shoeing prescriptions?
Yes, yeah.
And I want to talk to you a little bit about that because I think it's so important to collaborate with other professionals in this field. And I know that, at least in my area, it can be a little bit daunting to think about working with vets, really. Just to begin that conversation, do you have any tips for hoof care providers on how to forge a relationship with vets in your area?
Yeah, I think a lot of it just comes down to like appreciating where the other person is coming from. It doesn't matter whether you're a vet or you're a farrier. There's no way we can know everything about, the distal limb. And I find, because I'm working with veterinarians nearly every day, just appreciating where each other's coming from and making sure that we remain as professional as possible. I think if there's any animosity between the two, it's just differing opinions and how to go about it. And also for each party, we're not really sure of where the other's skill set can be. So I think, just make sure that certainly not discussing or having any disagreements in front of the clients is a really good start. Like typically myself, if a veterinarian has been at one of my clients or a new client that I'm going to call that veterinarian before I get to the appointment. I don't want to be discussing too much. I'd like to be cohesive in front of the client with the veterinarian when I'm there.
So when we're working with vets, is there a time where you might proactively reach out to them before you meet a client or before you see a horse that they work on?
Yeah, absolutely. It really just comes down to developing professional relationships. And if we approach the hoof industry like that, there can be no negative downside of that. So I think reaching out, like at the symposium recently with the Northeast Association of Equine Practitioners, that's the wonderful thing about a format like that, is you've got vets and farriers, and invariably you end up chatting away to them, and you might show them a couple of pictures, and they've got time at conferences and things like that to interact with you. And I think quite often in situations like that with open panel discussions, we can really get to the bottom of some question and answers that people have been thinking for a long time. So open up communication. You could always as well drop into the veterinary practice, introduce yourself. And I think just approaching the situation as a professional, and I don't think you can go wrong with an attitude like that.
Do you have any tips when you're meeting a veterinarian for the first time with a client or without a client?
Yeah, I think, when I'm meeting a veterinarian for the first time, if I haven't previously had a relationship with that veterinarian, I'll normally have the owner there with me. If we look at things to improve that relationship, and the first contact with that veterinarian as hoof care providers, I think dress tidy, be punctual, be articulate, and just, be open-minded as to what you're actually about to see. By the time, the vets run some diagnostics on that horse, you're going to know a lot more about the pathology or lameness. And sometimes it's a very simple situation. Sometimes, we may need to elevate it further from there. So I think just general professionalism throughout those appointments is going to get you a long way in establishing a good relationship with the veterinarian or other healthcare providers in the horse industry.
I know for me, a lot of the first times I'm meeting a veterinarian is for a radiograph appointment, and I didn't know if you had any tips for how to approach that or requests that you might have for a veterinarian when taking radiographs.
Well, I think it's a great situation to open up dialogue between veterinarians and hoof care providers. It's a fantastic situation for that because, the information is there and it's fresh. That's the exact time where I would open up some dialogue and I'd be like, well, we're seeing this and this. A lot of horses are growing out of balance between trim cycles. The first time I trim a horse, quite often, I'll know more about that horse when I go back in 4 weeks' time to retrim it because I can see how it's growing. I can see how it's perfusing. So, that first time I see radiographs, that's also going to help because at that time, really we're going to be looking at limb conformation as well. And I think all these things affect the hoof capsule, even down to a microvascular level where, we're seeing higher perfusion rates medially or laterally, and that can influence the trim a lot. So these are all things you can talk to your veterinarian about when you're at that appointment getting radiographs taken. So great place to open up some dialogue.
And do you usually have the owner let you know when that appointment is and try to just make it a point to go?
Well, quite often what I'll do is I'm the one instigating the radiographs, to be honest.
Yeah.
So, I'm in the picture, hopefully right from the very start. And, that's the hoof care provider's responsibility to make themselves available for that appointment. From there, you turn up, you introduce yourself, you can already start to, make some kind of rapport with the veterinarian and start to formulate a plan together. And I think that's the most valuable thing that working relationship can have, is just, starting to put the plan together. Both of you are happy with where it's at. Moving forward, you've got a plan, and if that plan doesn't succeed, well, then together you can put your heads back together and come up with something else, and you just keep moving forward.
And if you can't be at the radiograph appointment, do you ask the owner or the vet to get in touch with you, or send you a copy?
Yeah, absolutely. I always try to get a copy sent to me of the radiographs, so I've got them on file myself, which is really handy to have. You can kind of note the progress, and then you've also got a baseline radiograph going forward. So one of the first things that I'll ask for, especially on a new client, new horse, and in a new veterinarian relationship, so we can both have a baseline of where we're moving from there. So I think that's really important. I think, making sure we've used good radiographic technique in relation to podiatry, we're looking for different things. Dr. Brass and Dr. Roll have kind of noted in literature that we're looking for a low beam. We want the wings of the coffin bone superimposed on each other. So, as far as, getting the radiographs, I do like to be there when the radiographs are taken, but that's more so we can make sure we're getting the right views as we go.
Yeah, and so do you request views while the vet is there, or do you contact them beforehand if you know they're going to see a horse that you work on?
Yeah, there's certain views that are going to be relative to, hoof care professional. We're looking for laterals, we're looking for DPs, and then as soon as which are your basic balance radiographs. Beyond that, when we start to get into skylines and, navicular shots and that kind of thing, orientation of the beam is really important, as it is with your laterals and DPs. We want, like I say, that coffin bone, the wings of it superimposed. We've got to be careful about what we're viewing within the radiograph in a DP format, because, there's so much osteolysis found in coffin bones these days. When we address balance like that, sometimes we've got to look at the joint spaces of the coffin joint to get a true read. It's very, very common that, conformation and even the way the horse is standing on the blocks is going to have a significant impact on how those radiographs look in terms of, looking at balance. So I'm always looking at the health of the coffin bone. I'm looking for the positioning. I'm looking also at limb position while the radiographs are taken. So, like I say, the podiatry radiographs are a completely different thing. We're not looking generally at the coffin joint too much unless there's obvious pathology in there. So, yeah, we've got to be kind of careful when we're taking those radiographs and making sure we're getting the most detailed, accurate information we can.
Has there ever been a time when you've requested a view to be retaken because of what you're looking for?
No, I think most of the time that, if for whatever reason the horse may have moved or whatever it will be, both parties know that it's not an ideal shot. But, what can be a really good thing to do is, for hoof care providers to become familiar with radiographing. I think in the future that I'd love to see all farriers or trimmers or whatever it will be have a radiograph machine. It's so important to to make sure that balance is right. So an idea could be just turn up to the vet clinic and see if you can ride along with a sport horse veterinarian for a day and try to see what they're seeing, because I can, from working in a hospital situation, the changes that we see in the coffin bone are very, very significant horse to horse.
My name's Sean Morrell. I'm the equine podiatrist at Rood & Riddle in Saratoga Springs, New York. I predominantly work on horses with a lot of foot problems, from laminitis to navicular syndrome to infections, to just trying to correct some deviations in foals and yearlings and try to help keep the comfort of the horse going for as long as they're riding or in their career or for racing or even just for pleasure riding as well. Yeah, so I think having a veterinarian and farrier team to benefit the foot care of the horse is, paramount. I think both parties need to have a, good open mind, because Each person carries experience in certain aspects of the field. Not everyone is an expert in everything. So farriers might be more geared towards the application of shoeing mechanics. Certainly there are farriers that do a lot of therapeutic work, whereas veterinarians are probably more aware of the problems internally as far as structure and physiology goes, and what needs to be protected or what might need to be supported. So it's good to have both of them on board and have an open mind for each aspect, because what one person might feel is the best course for the foot of the horse may not actually work appropriately based on the other person's experience. So it kind of goes both ways. So it's always good to work as a team and maybe just come up with a game plan and figure out what's working and what isn't, because you can always go back and modify the foot care for the horse just to get them going in the right direction. It always helps when a vet and farrier team can kind of further education either together at a clinic or even just kind of working with other groups that have a little bit more experience, so that they can have a kind of general idea of what they can do for the horse, because everybody goes about shoeing a horse differently and looks at the foot differently. So if you happen to work with another guy that's been shoeing a certain way, they may point out things that you may not be aware of. Same thing if you work with another vet and farrier team. They may have had experience with a certain problem that maybe you're currently having an issue with, and just kind of reached about everything out of the bag to help the horse and just not getting anywhere, and they may point you in the right direction. I think people get a little bit irritated when the other party kind of dictates the entire plan, and especially when a person's more experienced and they've had some of these issues come about, they kind of see what works and what doesn't work. So I think just having an open mind to both persons' opinions, I think he'll come out with a pretty decent shoeing plan that helps the horse out in the long run and keeps the client and the horse happy and hopefully comfortable as well too.
And are there times when you're working with a horse that you call a veterinarian in, and at what point do you decide to do that?
It really depends. I think that's a lot of evaluation that our hoof care providers are really good at. We're very, very good at interpreting what we're seeing with their eyes and also palpating with their hands. We're very hands-on. And the thing about it as well is hoof care providers see these horses so regularly. We get to know them very, very well, their little intricacies that they have. So if we see that a horse is off or not moving so well, even the way a lot of the time horses feel when we're shoeing them, like if you pick up a back leg and the horse is tight and it's normally not, farriers are the first ones to feel that. So, if I'm seeing anything that could potentially relate to internal pathology, that I'll call a veterinarian in straight away. If it's something obvious, you might see it. You might feel that the digital pulse is elevated, and then I'll start poking around a little bit. And I think that falls, within a scope of practice for a farrier. Scope of practice for a farrier is something that's not talked about too often, because we kind of make our way into these situations and we research the pathology and then we'll give it a shot. It might be a hoof boot or it might be a shoe or whatever it will be. But generally, if I find something that doesn't quite stack up for me within my examination process that I have, I'll call in a veterinarian straight away.
And so do you have times where you feel that there should be a veterinarian involved and the owner is hesitant or doesn't really see the value in having a veterinarian see their horse too?
Yeah, I do. And I think that's a kind of issue that a lot of hoof care providers will find is, sometimes it's financial resources, sometimes it's the client just doesn't really see the value in having absolute diagnostics at that point. Again, I think, I have some clients that we will kind of walk our way through lameness a little bit, because as soon as we're talking about bringing a veterinarian in, we're normally talking that it's a lameness issue. And of course, there's a wide variety of lameness issues. So that kind of comes down to experience, whether that's something you think you can manage, whether you think it's hoof distortion related, or maybe something, deeper into the horse's foot that needs looked at. Again, it's just a really good time to open up those communication lines with your client. And my advice would be try to be as transparent as what you possibly can. I know some would say there's some animosity between vets and farriers at times, but after working with a large hospital like Brood and Riddle for nearly 8 years, without good sport horse medicine and diagnostics, my shoeing can be very hit or miss, and I think that's why we have a lot of success at the hospital, is because, as farriers, we can really fine-tune our shoeing to the pathology through diagnostics that we're seeing. A lot of pathology that we see through diagnostic imaging, whether it's ultrasound, whether it's MRI, whether it's radiograph, how we interpret that in our work as farriers is ultimately what creates success for the horse. So for me, I honestly, I couldn't do what I do without a good veterinarian behind me.
And can you think of a time when diagnostics really made all the difference in a case?
I guess I think diagnostics are important to diagnose a lameness, but then it's also important that we reassess,
Yeah.
As far as soft tissue tears go, we should almost be reassessing once the horse is sound to make sure that those supporting ligaments and all that are actually in good enough shape to move forward. So horse shoeing is, in a lot of ways, trimming is very, very easy, but it gets very, very complex very, very quickly.
Yeah.
I'll share a case with you that I worked on recently, and I think this is like one of those pivotal cases in my career and it's only been in the last few months, and it just shows you how you continue to learn and learn and learn, and it made me appreciate the veterinarian's input so much more, whereas I had this nice warm blood horse, and it was bilaterally off in front. I tried 2 or 3 different shoeings, and we thought it was saddle fit. I was communicating with the veterinarian, and we're both a little bit not really sure what was going on. And because of the duration of the lameness up to that point, which was like 2 or 3 months, and I tried 2 or 3 different shoeing modalities to try and offset this lameness, luckily the owner was very, very open to an MRI. So we sent the horse down to the hospital, had an MRI, and it had impar ligament strain. And it was a really turning point for that horse's future, because, here I was trying to get this horse going, I was doing this, that, the next thing. But ultimately, as soon as we had that diagnosis of impar ligament strain, that horse had 16 weeks rest. So, and that's what I say is, this integration from veterinarian to farriers, without that information, I would have been doing that horse a misservice. Certainly, it was a clear case to me that with more information, we can really help these horses a lot faster. Retrospectively, I spent 12 weeks trying to get that horse sound with different shoeing changes. With 16 weeks rest, that horse is back in work now and performing well, because we knew exactly what was going on. It certainly opened my eyes a little bit, and I think we need to be sure of what we're doing when we're trying to influence lameness. Hoof care providers don't talk about the contradictions within hoof care, which I think is really important, that we can learn just as much from our failures as our successes.
Yeah.
So my name is Ron Gaida. I'm an equine veterinarian based out of Newtown, Connecticut. Been practicing for 32 years, primarily with what we now call sport horses, hunters, jumpers, dressage, and polo. Also have a smattering of Western pleasure and barrel racers. I've been very fortunate in my area, northern Fairfield County, Westchester County, that we've got a lot of super farriers, and we've always worked well together, the majority of us. But it's gotten to be more and more important these days that the vets and the farriers all work together to benefit the horse, because if you don't have a good base below you, it's going to affect everything up above. So we really work hard to foster that relationship. It's one of the reasons I became involved with the Northeast Equine Practitioners at its inception 11 years ago, to try and just really cement that relationship and build on it. It's in some instances, it's been a little hard, because over the years, farriers have been sort of talked down to by veterinarians. I've seen it happen multiple times, and it's not fair, it's not professional. We have a lot to learn from the farriers, and there are certainly things that we can teach them as well. And by working together to, help them to utilize radiographs and recognize the different pathologies in the foot and what we can do about it together, we're all going to help our patients.
I think something we often struggle with is when, as vets and hoof care providers, we have different ideas on which exact approach to take on the horse's feet. When I asked Stuart about this, he encouraged me that instead of talking about a particular prescription, to consider the concept we are looking at. What internal structures are we hoping to stimulate or improve, and how can we affect those with our work? Talking about the concepts with the vets may get at a variety of approaches that we both may be comfortable with. Are there times when the veterinarian prescribe something that you think might not be as successful as something else that you can try?
You know, within the realm of horseshoeing and therapeutics and horseshoeing and stuff like that, there's almost like a revolution happening right now with pressure plates and other diagnostics where we understand the loading forces that are associated with different therapeutic shoeing. So some of our principles and theories are actually changing very much right now after 100 or 200 years of the farrier profession not changing much at all. We're actually seeing quite a lot of change right now. And that can be through, composite shoes or whatever else as well, where there's a lot of things open to practitioners. But as far as challenging a shoeing prescription, if I think we could do better for the horse, I will normally talk to the veterinarian away from the horse itself or away from in front of the client, and just more deliver concepts, like let's use a pathology like navicular because it's widely known. Typically we wedge the feet up and we'll do all sorts of things, but that comes with certain complications over time as well, and all of a sudden like a very simple idea gets very, very complex. Well, you can very, very quickly contradict yourself with your shoeing prescription. So for hoof care providers, I think the details matter. It's not, we can't really just give it a blanket approach where it's like this shoeing prescription has worked for 100 other horses, therefore it will work for this horse. So I think both sides need to be open to the idea of that the shoeing over time may not be sustainable. And for two, that all going well, to be honest, I'd like to see the shoeing start to change over time. I'd like to think that whatever problem we had, unless it's really established pathology, that hoof capsule distortions are going to start changing, and therefore the shoeing prescriptions and the trimming is going to need changing too. So there's a certain amount of fluidity to the situation where both parties should be aware that things are going to need to change.
So I'm Jennifer Melcher, and I'm an equine veterinarian right outside of the Atlanta area. What I noticed was that a lot of vets and farriers were having trouble communicating in my area, and that farriers would almost recoil at some of the things vets were saying. And I felt that maybe there was a problem with the communication between the two, because we do speak slightly different languages. And trying to learn one another's languages, we can do better for the horses overall, rather than fight one another. Really, the outcome is usually the same. We want the same outcome, but we fight each other getting there. And in the end, the horse loses. It's not about egos. In the end, it's about the horse. I mean, I think the biggest problem is communication. I think most of the time when I have to work with a farrier, or if there's a shoeing issue that I believe can be remedied, instead of doing it, with a phone call or writing a prescription, I would recommend calling the farrier or calling the client and looping together where that you are at the barn at the same time, that you guys meet there and you talk about things. You take radiographs before, you spend the time that it takes to assess the horse in the beginning. And then if they need films after they tack the shoe or after they trim, do that. Whatever it takes, I think, in that moment to show that you're willing as a vet to come to the table and listen to what the farrier's ideas are, because there's not just one way to do something. That's the same as, between farrier to farrier. I mean, everyone's going to do it slightly different. But I think it comes down to communication and understanding each other's languages. On the whole, from what I've seen on my side, I mean, I'm a vet, but I see that there's a lack of respect in both directions between vets and farriers. It just doesn't have to be like that. They are professionals just like we are. And they have knowledge that we don't, just like we have knowledge they don't. And if we can, come together, it's a meeting of the minds. You get a synergy there that should be there all the time, but most people don't allow it. So that's why I totally echo what most people would say about communication. That's the number one thing.
So my business focuses around barefoot rehabilitation using boots and pads or casting or composite glue-on work versus metal. And there are times when a vet prescribes something that doesn't really fit into that. And I'm always happy to refer those horses elsewhere if the vet and owner want that. But is there a way that I can suggest something to the vet that I am able to do or provide for the horse that I think will be beneficial without, sounding rude or off-putting?
As far as, I think every shoeing or trimming, it doesn't matter what we're doing, should be a well thought out process. We can't be too polarized about the way we approach cases because every case is so individual. Now, if you're sitting there with a certain trim or a shoe that you think may benefit the case and you can communicate the benefits to the veterinarian, I would 100% go ahead and do that and see how receptive they are to it. But, if that case doesn't respond, well, then it's time to dip back into your bag of knowledge and try something else. So it really comes down to communication with me, and I've just had so much luck with being open and honest and with veterinarians and just seeing what they have to say, because every pathology is so different, and I think we need to keep that in mind. So it's a difficult one. I know a lot of hoof care providers kind of struggle with it because we spend so much time researching these things and trying to do the best by these animals we can, but ultimately the veterinarian is also responsible for that case. So it's certainly a fine line to walk between both parties. And I think a lot of it, establishing these good relationships with veterinarians it comes down to simple communication, being articulate and certainly knowing your anatomy. A lot of the time, I think where the veterinarians and farriers kind of don't get on so well is showing prescriptions can get very precise, and sometimes we need to deliver a concept more than an actual showing prescription. So,
yeah, I mean, I definitely agree, and I'm lucky that we have some really great teamwork in my area between vets and farriers. But there have been times where I feel like on either end there might be some resistance, even if we're talking not in front of the client and where there's, less pressure from having to be professional in front of them. Do you know if there's a way to kind of diffuse that and show that you're not trying to,
Sure.
overstep any boundaries?
I think that a lot of the time, we can be pushed for time when we're at a client's place, but finding the time to just communicate with each other. And, some hoof care practitioners are the most educated people in the horse industry about the horse's feet, and a lot of veterinarians are picking up on that. So just through open communication and letting that veterinarian know that you have spent some time studying this, you're passionate about the case, and I think a lot of the time as well is it's just being open to new ideas. We've got to be careful that we don't end up in a situation where we just apply the same principle to every single horse. There's an infinite amount of possibilities with pathology and hoof capsule distortions. So when or if I do meet any resistance, I'm very, very open to it. I'll always hear the veterinarian out, let them get their side across, and then I'll just start kind of planting seeds of what I believe would be good for the case, and hopefully we can meet in the middle somewhere.
So my name is Raul Brass, and I'm from Lexington, Kentucky. I'm a vet at Root and Riddle Equine Hospital, and I went to Cornell Farrier School as well with Mike Wildenstein. I've been with Root and Riddle Podiatry Department close to 15 years now. Originally from Puerto Rico, born and raised, and been with horses my entire life, so horses is just what I do every day. The vet-farrier relationship, something that the industry's been working on since I started, to be honest with you. And I think about this all the time because a lot of times I have to work with both, and I have always asked myself a question: why is it that just sometimes it doesn't go well? And it's as simple, but it's as complicated as communication. It's not that we're not communicating or we're not talking, but a lot of times there's that third party in there. There's that third person. That's the client. That's the owner. So sometimes we don't even communicate with the farrier. The owner will be the one that tells the farrier, well, the vet wants this. Or vice versa. She'll be going and talking to the farrier and be like, he wants to dictate how exactly you shoot this horse. Things like that. And sometimes I think that it's just probably taken in the wrong way because, the more I think about this, you have two professionals, vets and farriers, that are extremely passionate to what they do. So they take it very seriously, but we also have to, as a practitioner, talk to each other with respect, and not only that, to learn how to agree to disagree, because there's not a problem. There's been many situations where I've been talking to a vet or a farrier, and I wouldn't agree what they're saying. I gotten to a point that instead of beating bushes or going around it, I just go directly, and I just said that, with all respect, I don't agree with what you're recommending or you're saying, but we can talk about it. And actually, you end up having a better relationship because you bridge that gap that is between the vets and the farriers. I think that if we just directly have the vet call the farrier, or the farrier call the vet, and then directly communicating with each other, we might help out with the misunderstanding of he said, she said, because a lot of times, let's be realistic, sometimes even the clients will basically request what they want and manipulate the situation with the vet and the farrier so they get away with what they wanted, not what the vet wanted it, or not what the farrier wanted it. So, like I said, it's something simple, but it's a little bit complicated as well.
So do you think, if there's a time that you see a horse that might have some other issues going on, like maybe there's some metabolic issues or maybe some diet issues where the feet are affected as a result, do you think that there's a time where that's appropriate to bring it up with the veterinarian?
Yeah, I think the hoof care provider is always one of the first, because we see the horses so regularly that we tend to notice these small differences and changes in weight and the effects of diet changes throughout the year. So quite often if I do notice those and there's a history of the horse being metabolic, I'll just suggest that we do run some bloods on that horse and we get to the bottom of it before it becomes a problem. I kind of feel that sometimes as hoof care practitioners, we're quite reactive to things. The horse has had a laminitic bout and, we're kind of picking up the pieces afterwards. A lot of the time, I'd actually rather be more pragmatic about my approach to this work and hopefully avoid any pathology or any damage to the hoof capsule before it's a problem. So, yeah, I will definitely either call the client or text them and say, hey, look, I noticed, the horse, pony, whatever it will be, is having a few issues, or, it looks like there is something potentially on the horizon. And normally that's very well received from my owners and trainers, and they'll go forward and get some tests done on their horse. So I really find that can be really beneficial to the relationship. I've always found veterinarians super receptive to anyone that cares about their clients as well, because ultimately the relationship is, there's 3 or more parties looking after these horses a lot of the time. They've got chiropractors. I'll also talk to the chiropractors as we go, and I'll be like, hey, look, this is what I'm noticing. The horse felt a certain way. And veterinarians seem to also appreciate it too. They're like, you could just mention that the feet seem a little bit warm or the digital pulses are up. And, especially in the bluegrass area, the veterinarians are more than happy to shoot radiographs for you, and we can take a quick look inside. And it really does come down to just that pragmatic mindset where we're continually trying to be ahead of the game. So, no, I've never seen negative responses just in kind of talking about the case, because both parties, hoof care practitioners and veterinarians, are very much involved in these cases. So getting the two to work together is just the most ideal situation.
One thing I'm really appreciative in my area is I do have a veterinarian that I work with because he's my own personal horses veterinarian, and he covers a lot of the horses in the area. And I think he's very open to dialogue with me about mutual clients that we have because he's seen me work on my own horse for 6 years. So we kind of naturally have that easygoing relationship. But with some other vets in my area, it doesn't seem that simple or that easy. And I'm not sure how to better get that. I mean, not demand respect in any way, but
just a bit of rapport, right?
Yeah, right, exactly.
Let me see if I can come up with some epiphany here. I think what it comes down to is I 100% support the farrier industry and the hoof care industry. I think where we see a little bit of uncertainty from the veterinarians towards farriers is that, like every veterinarian goes to vet school, they've got extensive schooling and they've spent years doing it, is, to a large degree, the hoof care provider at every horse, there's a lot of disparity, not only in knowledge, but skill set. So I'm now sounding like I'm advocating the veterinarian side, but the ability of the hoof care provider that the veterinarian is with, they're not exactly as sure as what we are. We know that that veterinarian has had X amount of schooling. Right. So, there's a large variety and ability and knowledge within the hoof industry. And, I'm not saying we should have legislation or anything like that. I don't think that's the answer, but it's a lot of the reason I teach. If I can enable that person to find that desire to learn more and more like I have and still try to continue, hopefully just generally the farrier industry as a whole does better. The more people that we have surging for education, I think overall, globally within the industry, it should help.
Right. Yeah, and I get it. I mean, they're coming at us as not knowing where we're, what kind of background or education we've had, and it can be, troubling for them.
Yeah, there's so many ways to treat everything, and I'm really appreciative of that, because there's a lot of different theories within the horseshoeing industry. You could talk to someone about hoof past and axis and they'll absolutely advocate for that. And other people shoeing around the center of rotation, absolutely advocating for that. We've had the barefoot community really come on strong in the last few years, and that's wonderful. And the reason I say it's wonderful is because I don't necessarily think there's one answer. I think there's so many different answers. At certain times, I will use Dr. Redden's theories, and other times, I'm thinking about Dr. Bolker's work and how I can influence the back of the foot. So I think a lot of the time as practitioners, we're pulling all these pieces together, and that's where you get someone really, truly talented, I think, is that we have such an overview of all the styles. We start amalgamating them and pulling different pieces together. And that's almost like, I think, when the magic happens, you start seeing progress in the horse's feet. I guess I'm saying that I would encourage everyone to get, within the farrier industry and just to become more open-minded about other theories and, learn about them, maybe use them, maybe don't. Maybe on some feet they won't need that theory, but maybe another horse will. So I think it's just a good time to be kind of educated right across the board. I use the barefoot trim a lot, but I'll also shoe on top of it too. I think there's some of the fundamentals within the barefoot movement are just absolutely wonderful. They make so much sense, And then other times, like I say, I'll pull in some of Rick Redden's kind of theories on certain pathologies and foot types, and I'll use that. Because I think there's an infinite amount of possibilities that you're going to come across as a hoof care provider. So the more options you have at your disposal, I think that's when we really become quite good at, interpreting hoof capsule distortions and how we can influence them in a positive direction.
And is there a way to sort of, talk a little bit about your own training and background without seeming like you're coming at them with a resume or?
Absolutely. On that subject, I find, this industry, the hoof industry that we're in, is the most humbling industry that you could possibly hope for. I think retrospectively about my own practice back in New Zealand and now working for the hospital, I've had some cases that surprise me where they go well and others that just don't. So when it comes down to informing the veterinarian that you are experienced and you've spent time studying this, I think, just tactfully go about it. A lot of it is just trial and error a lot of the time, and just be prepared to try new things. If we try one way and we're having no success, well, it would make sense to try another way. So just be open-minded, be flexible, because what I've found personally in those situations when I am of that mindset, that's when I actually learn the most.
My name is Sam Zaleski. I am a resident farrier here at Rood & Riddle Equine Hospital in Lexington, Kentucky. I think that organizations like the NEAP that Stuart's involved with and Dr. Bross, and you have kind of a collaboration as far as the board of directors goes. There's farriers and veterinarians involved in the shot calling process. And I think it's going to be one of those things where it's going to take a few years to hopefully bridge this gap, because we all have to admit that there is quite a gap between veterinarians and farriers for sure. And I think it's organizations like this and several others that we need to really focus on and kind of try to bring the community together. So I think that it's super important to have people like Stuart and people like Dr. Bross on both ends of the spectrum trying to bring everyone together. A certain example, just a few weeks ago, I had a veterinarian that I don't work with that often on a horse out of town that I go take care of. They said almost 4 weeks into the shoeing that there was a bad nail by me. And most of us all know that a bad nail is not going to present itself almost at the end of the shoeing cycle. And there's things like that I think if we continue to do this continuing education and bridging this gap between us to where hopefully we can try to bring stuff like that to an end. Just trying to put a lot of focus on bringing us together. Stuart has a phrase that he says a lot of times, and I think it's very true, and it made me stop and think the first time he said it. He said that farriery is very much need of a huge leap forward. I think sometimes we get caught up in that argument of, well, we came from here, and this is what traditionally we've always done, and this is where we need to stay. And sometimes I think it's under that cloak of having, basic skill and always just go back to the basics. And obviously, I think that a lot of us hoof care providers are met with a lot of cases where we need to jump forward a little bit. And lots of times we need to collaborate with a veterinarian. And I think that that's one of the things that gives me a lot of hope, is seeing what a vet and a farrier can accomplish when they really do work well together. In this day and age where horses are doing more and more and our diagnostic capabilities and our imaging capabilities have come so far, we've gone from taking a radiograph and having to go back to the vet clinic to develop it just to find out that it's a bad shot to have to come back and retake it again. Now we have images that come up instantaneously and we can be there and check everything out and be so thorough that there's really no excuse for both of our industries anymore to not work together.
So bringing that back to your own practice, what are the kind of horses that you see or work on the most?
I've really always been drawn towards the sport horse, and that kind of will be, jumping to dressage to polo to whatever event is, whatever it will be. And a lot of my work is managing pathology and just trying to keep, horses with essentially high miles, keep them going, which, poses certainly a lot of challenges along the way. I deal with a lot of soft tissue problems with horses' feet, especially in, the distal limb. There's just so much soft tissue structure down there. So typically on, most days, that's kind of work I'm doing. Certainly, navicular comes into it. Laminitis comes into it. The wonderful thing about the hospital is we've got some doctors at the hospital that are wonderful about managing laminitis. So I will push those cases their way if I feel like they're almost getting too high maintenance for me. I try to keep myself in a realm of what I'm reasonable at doing. I'm not too shy in pushing a horse with unstable laminitis back to one of the other podiatrists at the hospital that has diagnostics at the drop of a hat. So at the hospital, I see a wide selection, and most of it that amazes me on a day-to-day basis is just, especially with MRI, I've had a lot of MRI cases lately where the pathology that goes with those horses is generally not anything you'd think it would be. It doesn't look like it would from the outside, and really makes me appreciate having diagnostics to kind of fine-tune my shoeing, because some of the things I've seen recently, there's just no way from the outside we could have known that pathology was sitting there. So.
Yeah.
It certainly makes you appreciate what pathology a lot of horses are carrying. Quite often a horse may go down for an MRI and we get the results and I was like, yeah, I kind of suspected something like that, but then there's all this other stuff and you're like, this horse has just got high miles on it for the horse's age and discipline. You do see those horses with perfect feet and you're like, there should be nothing wrong here. It ticks all the boxes of what I like to see, but the horse is still lame.
Yeah. So what is your favorite kind of case to work on?
That's a tricky one. I just really enjoy seeing horses go back to their chosen discipline and compete. If we can take a lameness and we can turn it around, I get a lot of enjoyment out of that. The challenge of managing pathology and the intricacies that go with it, it's that challenge for me where I feel like the horse is continually challenging me to get better. So I really enjoy that.
Yeah, I feel like it's something where we're always learning and adapting. So with that in mind, do you have any final tips for hoof care providers?
I guess a lot of it just starts with just remain open-minded and make sure that you continue your education as you go. Certainly don't hesitate to bring a veterinarian into the shoeing prescription if you need to and get those diagnostics and make sure the horse is maintained with sports medicine as well. As far as the veterinarian and the farrier getting along, my shoeing can be good, but with some good sports medicine in behind me, the horse can be really comfortable. So I think the integration of those two parties working together, we're going to see more and more of it in the future. So it's a good time to be on board with it. As far as dealing with hoof capsule, conformation and distortions go and pathology, I think it's just make sure you take the time to really look into the feet and kind of decipher what the feet are trying to tell you. Because ultimately, they're going to adapt to environment and limb loading. It could be conformation changes. And there's certain things we can kind of help, and then there's some things we're just going to have to manage as we go. Stay open-minded and enjoy what you do. I think that's a large part of it. I personally enjoy the challenge of it myself, and if you kind of see the situation like that where there's a chance to make a change for that horse, do your homework and kind of just put it all together.
Well, thank you so much for all your
pleasure.
time.
Thank you. Awesome. Well, I really appreciate the opportunity.
Yeah, I hope you have a great night.
Okay, thank you.
Bye.
Okay, bye.
I think the one thing that I've really respected about Stuart, and that he's taught me a lot about how to deal with certain situations, he looks at things and he's always watching feet and how feet are changing. And I think that lots of us farriers at some points can be kind of guilty of the horse is going well, everything's okay. We might be noticing some subtle changes in the feet, whatever it may be. Maybe the hairline's starting to jam up on one side. Maybe we're starting to get a small toe crack or things like that. And I think sometimes we get a little bit afraid to change things while the horse is doing well, but we're starting to see something that's detrimental to the foot per se. And Stuart's always been one of those people that I've seen where he notices those things and he's not afraid to make a change to hopefully just keep everything going that way, to where we don't sacrifice the horse losing a month or two because he pops a quarter crack or something. He might notice some subtle change going on, like, hey, I think we need to head this off and nip it in the bud. And he can communicate that to the client well enough. He has a gift kind of being able to talk to people, and that's one thing that I really respect and something I've really tried to emulate.
Stuart pretty much always says it right the first time. He's amazing. He's a natural. He's so well spoken and very thoughtful, and just he really knows what he's doing. And he's just an all around great guy.
I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.